Hello everyone, I'm John Connolly, Deputy Commissioner and State Medicaid Director at the Minnesota Department of Human Services. Thank you for joining us. We're here today to share information about the importance of Medicaid across Minnesota and the serious harm that could happen right here if Congress goes through with deep cuts to Medicaid. And while those conversations often begin with policy or budget numbers, they should always come back to the same thing: people. Medicaid, what we call medical assistance in our state, supports more than 1 million people in Minnesota. It's a lifeline for newborns, seniors, people with disabilities, and working families just trying to stay afloat. The Minnesota Department of Human Services wants to be sure that all Minnesotans know what is at stake with these cuts: real impact on real people. Now, it is likely that you have been on Medicaid, and at some point in your life have been on Medicaid. If not, you definitely know someone who is or has been. Medicaid is the largest single source of health insurance in Minnesota. The program has been in place for 60 years this summer. Currently, 40% of children in Minnesota are covered by Medicaid, which also covers half of all long-term care costs in our state. The list of impacts goes on. Today, we're going to meet some people who will talk about the importance of Medicaid in their lives and how their lives will be changed if people were to lose access to Medicaid. We'll also talk to a partner from the Minnesota Department of Commerce about the importance of Medicaid to our economy and the impact of potential Medicaid cuts across the state. And we'll hear from a physician about how care for patients will change if these cuts come to pass. So welcome to all of you. Julia, let's start with you. Julia Dreier is a Deputy Commissioner at the Minnesota Department of Commerce overseeing insurance. Tell us how even those people on private insurance will be impacted if drastic cuts are made to Medicaid.
Thanks, John. As you noted, more than 1 million Minnesotans rely on Medicaid to help pay for needed healthcare services. However, what is sometimes less obvious is how Medicaid creates a stable healthcare marketplace that benefits all of us. Real or even threatened cuts to Medicaid make the healthcare that everyday Minnesotans rely on unstable and uncertain. In Minnesota, we've made amazing progress the last 10 to 15 years in that almost everyone, even during a pandemic, has access and a place where they can find insurance and get care. But when one person loses coverage, it makes it harder for everyone to access coverage. Losing Medicaid would make it harder for clinics and hospitals to keep their doors open. This would mean reduced services or closures, leading to longer wait times or even loss of access to care. Rural hospitals receive a disproportionate and growing amount of Medicaid and Medicare funding, and funding uncertainty from these sorts of cuts could lead to rural hospitals closing or even cutting services. At Commerce, we regularly hear concerns about how hard it can be to get in to see a doctor, or how some people drive for more than an hour to get to a hospital or a clinic, and Medicaid cuts will exacerbate these problems. Furthermore, we know from past experience that once a community loses access to these services, or a hospital or a clinic, that those healthcare services and jobs rarely return. We also know that when people lose health insurance coverage, they also lose access to life-saving medications and treatments, as well as important preventative care. They are also more likely to have medical debt for needed care that they do receive. Additionally, costs associated with any sort of emergency care uninsured individuals receive indirectly increases health insurance premiums for everyone else. Minnesota is consistently ranked as one of the healthiest states, and this is because as a state we have invested in programs that keep people healthy and care for them when they're sick. If Minnesota wants to retain and maintain the same level of health care for Minnesotans in the face of rising costs, state government would have to fill in that gap, potentially leading to tax increases or cuts to other programs that Minnesotans rely on.
So it matters to everyone. Thanks for that valuable perspective, Julia. Let's move over to hear about Linda's story, Linda Fess. She had a health crisis, what we might call really bad timing. She didn't have an employer, and she had a mountain of higher education debt. So if we could talk now about Linda's story and what happened to her.
Sure. So my name is Jen Amundson, and I work in communications at the Department of Human Services with John. And I'm here today speaking on behalf of Linda Fess. Linda is an enrollee who shared her story at our roundtable in Bloomington about how Medicaid helped her, and she wanted to be here today, and I'll explain in a minute why she isn't. But she asked us to share her story again today with you. Here's what she said. I am on Medicaid because about 10 years ago, at the end of my doctoral study, I started to feel a little ill, and then found myself very sick, very poor, without any insurance, and unable to afford the $900 a month for full benefits. Luckily, I had a friend who worked for DHS, and she showed me the combined application, which is the application for Medicaid and other benefits. I was able to apply for health insurance that day and use it that day. Very soon afterward, my doctors found out that I had a congenital heart defect, and my life was saved because I had access to health care. Otherwise, I wonder if I would have thought this is just a cold, and I would have kept going, and something drastic could have happened. Because of Medicaid, I don't have to worry about seeking help. When I need surgery, which I have needed a few to save my life, I have been very sick and very close to death a few times. I don't have to worry about needing special imaging for my heart, and I was able to get that life-changing diagnosis and medical care. My body was being destroyed, and I'm thriving now. I didn't have to pay for any of that because I couldn't pay for any of that. The interventions that Medicaid has brought, it's not just healthcare. I was introduced to a coordinated care center. They have a multidisciplinary approach to medicine. They provide therapy, they provide dental care. You can get everything done you need, and that's such a great clinic model for someone who has trouble with mobility. I thought, well, they're treating me like a VIP, but then I noticed that's how they treat everyone. I can focus on my wellness. I cannot worry about how I'm going to pay for care or what treatment I have to skip because I need to eat or because I need to pay for something else. I can just focus on being well and contributing to society in other ways. Linda wanted to be here today because she is compelled to share her story and talk about the importance of Medicaid funding because it's been so crucial to her. But 3 days ago, she went to the hospital in an ambulance and had an emergency appendectomy. Here's what she shared with me since then. I feel very thankful to have Medicaid, which allowed me to have the lifeline button that I pressed when I got the sudden pain in my abdomen that left me unable to function after having a high fever and chills all night. Having Medicaid put me at ease during this time, knowing I wouldn't have a medical bill for the ambulance that got me to the hospital, for the CT scan that diagnosed the appendicitis, the surgical team that healed me, and the nurses and support staff who have taken such excellent care of me. Without Medicaid, I can't imagine the bill I would receive, the damage to my credit, and how it would set me back on my lifelong dream of finally owning a home, all because of a common medical condition that could happen to anyone. So, Linda, we want to thank you for sharing your story. We want to wish you a very speedy recovery, and thank you so much for allowing us to share your story and encouraging us, really, to share your story. I think, John, this really illustrates how it can happen to anyone at any time of your life, whether you are financially prepared for it or not, and Medicaid being there to help her, a Medicaid that's easy to access and supportive of the enrollee really just made a huge difference in her life.
Thanks, Jen, and thank you so much for sharing your story, Linda. I'm sorry you went through that, but also glad Medicaid was available to help you so you can focus on getting through your treatment. And now, Dr. Cassis-Ghavami, you work with patients who have HIV, particularly pregnant mothers and babies, and you work with them to prevent transmission of the virus. So tell us about the role that Medicaid plays in keeping that population healthy. And we should say Dr. Cassis-Ghavami is here today speaking to her own professional experience and not representing her employer.
Thank you. First and foremost, I'd like to say thank you so much for having me weigh in on an important issue, not only for our state, but for our country. Having the proposed budget cuts to Medicaid affects me both professionally as a physician, but also personally, which I'll get into a little bit later. And as John said, I am the clinical director of the pediatric and perinatal HIV program at Children's Minnesota, where we provide comprehensive medical care, including HIV medications for children, families, and pregnant people living with HIV. We serve a very vulnerable population. Our population not only has a lifelong illness, because as you know, HIV, there is no cure, but with regularly administered medications, patients can live a very, very long and healthy life. And so not only do we have patients that need medication on a regular basis to sustain life, most of the patients that we treat are patients that come from what I would say marginalized populations. So 80% of our population are people of color and are identified as foreign-born. Most children immigrated here with their families or they were adopted. Minnesota, we're fortunate to have a large adoptive population here. We also have, out of our population, most actually live below the poverty line, meaning that they require medical assistance to help them access medical care. So Medicaid not only has provided these people opportunities to access medical care, but continued medical care and HIV medications. It allows them for their clinic visits, provider visits, co-pays for expensive medications, like I said, to keep their disease under control, as well as medical transportation. Some families, they have barriers as far as coming into clinic. And so Medicaid covers their transportation to ensure that they stay adherent to care. With programs such as medical assistance, we've been able to keep people's disease very well controlled. We've watched children grow into adulthood, have families of their own. We've actually been able to prevent the transmission of HIV to a child from a pregnant person living with HIV during pregnancy, while they were delivering and after delivery and through breastfeeding. And we've decreased those numbers to 1% or less with medications that these people access every day. We have not had a case of perinatally acquired HIV in the state of Minnesota since 2017. And this is all work that we have done. And if we didn't have a program like medical assistance, these people would have a large gap in accessing medical care. So what does it look like if we lose medical assistance for this vulnerable population? We are going back to the 80s when we had the early epidemic of HIV and AIDS. We will have hospital wards filled with children dying of AIDS or AIDS-related illnesses. We will have increase in rates of perinatally acquired HIV. Before the advent of highly active antiretroviral therapy to treat or manage HIV, the transmission rate for perinatal HIV was 25%. Now we have it down to 1% or less, like I stated before. And so we will be going back to higher rates of transmission. And basically we're condemning children to having a lifelong illness where they will not have access to medication because they will not have the medical assistance that helps cover their medication. And so basically you're giving them a death sentence. And I don't think anybody would feel comfortable with that. So I think it is imperative, not only for this population, for children all over the state of Minnesota, but particularly this population when you're giving them a death sentence or a disease where you're saying that we can't give you a way to access medical care. We can't give you a way to access these medications that will prolong your life. On a personal note, I am a physician, as I stated before. I have a son who was born with a congenital heart defect. He also has autism. We've relied tremendously on medical assistance to help with our co-pays for medications that he needs. We have also relied on medical assistance for a lot of his therapies and services as part of his autism. I'm happy to say that he is a 21-year-old adult who lives independently in residential living with peers, and that would not be possible without medical assistance. We would not be able to afford or even be able to access half of the things that he's been able to afford to have him live such a healthy life. So I do urge everyone that this is an important issue for the entire state of Minnesota, not just the populations that I take care of, but overall to anyone that relies on medical care and does not have the needs to actually pay for it on their own, such as someone like in Linda's case, who would probably be bankrupt and would not be able to be getting the surgery that she needs. So thank you very much for having me on this important panel.
So we wish your child and your family all the best as you continue with their care. Thank you so much for your time and perspective today. I want to thank all our guests, Julia, Linda, and Farah, and Jen, for joining me today to share information and stories about the impact Medicaid has had on Minnesotans. It is a lifeline for so many, and to our viewers, we appreciate your time in watching. If you want to find out more, I encourage you to check out our Medicaid Matters web pages. The address is on the screen, and there you will find data specific to the county where you live, statistics about who receives Medicaid, and the personal stories of people who are enrolled or work with those who are. You can even submit your own story. Again, thank you for your time and attention. Please share what you've learned.